Anastasia Palaszczuk, good morning to you.
Good morning. Good morning.
Do we have any update on the figures today about the number of people infected yet?
No, I'll be getting that information in the next half an hour, and we'll be having a meeting with the health authorities, and then we'll be doing a public press conference at 9 a.m. Queensland time this morning.
Okay, and we'll certainly carry that live on ABC News. That's 10 a.m. in Melbourne and Sydney. Have you been able to confirm through the genomic testing yet whether the nurse and her sister are linked to the other cases?
We will get that information again this morning. So, of course, Health have been working overnight to look at those issues in greater detail. So we'll be able to update everyone later on this morning. But we do anticipate that we will probably see more cases today. I mean, it would be highly unlikely not to see more cases.
Okay. One of the issues is that nurse was not vaccinated. The Courier Mail is reporting this morning a survey from the AMA which finds that more than 40% of public health doctors in Queensland still have not received their first jab. I mean, that's just not good enough, is it?
Well, what I can say is that 41,000 of our frontline health and our hotel quarantine staff have actually received their first vaccine. That's around 89%. So that's a good sign, and it's just unfortunate in this issue that this particular nurse worked one shift in this ward where she was unvaccinated. My understanding is that over the next couple of weeks, that will be 100% of people vaccinated, and around 7,000 people have been getting their second vaccination. So the vaccination rollout is going ahead, but of course we want to make sure that that particular cohort gets their vaccine as soon as possible. But we currently have 73 active COVID people in our hospitals at the moment. 63 of those, I'm told, around 63, are people who have acquired that from overseas that have been in our hotel quarantine. So a few months ago, we were down to, I think it was 2 or 3 positive COVID patients in our hospitals. We have seen a dramatic increase over particularly the last month, because we are seeing large numbers of return travellers that are testing positive and are testing positive to that UK strain.
Okay, so that is obviously increasing the risk for those frontline workers. You said
Correct.
Yesterday that there are 2 reasons for the lockdown. One is to prevent further transmission. The other one is to give your contract tracers a bit of extra space to do all of their work relating to the cases that we know about already. Why can't your contact tracers deal with 7 cases without shutting down Brisbane?
Well, we need to do this because this is the highly infectious strain, and we needed to do it quickly. We needed a sharp, hard lockdown. It worked effectively when we did it last time. It is a very big and a very tough call, but I have to take the advice of health, and I took the advice of Dr. Young. I mean, Dr. Young's advice to me has stood us in very good stead and has kept Queenslanders safe, and her advice was to do this because we were seeing community transmission out there, and when you have free-flowing, unlimited restrictions in a lot of areas, that means a lot of people gathering, a lot of people meeting, and we needed to contain it quickly, so we needed to do this snap lockdown.
And just finally, Premier, I mean, you will have, of course, weighed up the impact to your tourism industry, particularly at this time of Easter. Absolute devastation is how the impact is being described in some quarters. Will you, as JobKeeper has come off, will you be offering assistance to any of those businesses who may have lost revenue because of this lockdown?
Yeah, I've been very strong that I absolutely believe that JobKeeper should have been extended and especially targeted at some further relief measures for especially those businesses in the tourist industry that have been hard hit by the closures of international borders. A lot of operators across Queensland, of course, are very much looking forward to the school holidays, and we are keeping our fingers crossed that this current breakout can be contained in the 3 days, which will allow people to go ahead and enjoy their Easter plans. But it's unfortunate, but we've got to keep the community safe, and I think the tourism industry would be very unforgiving if there was a mass outbreak in one of their tourist hotspots. That would be damaging not just locally, nationally, and in the future internationally.
Fingers crossed you can get on top of it in 3 days. Premier Anastasia Palaszczuk, thank you for your time today.
Thank you very much.